Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
The Ministry of Health has on several occasions been tasked to explain the anomaly in the statistics of the COVID-19 pandemic in the country. To date, Uganda has confirmed 859 COVID-19 cases and 794 recoveries with no deaths. This would simply mean that we have 65 people in hospital, but this is not the case. Uganda has 190 active cases spread across the country ailing with the infection. According to the Health Minister, Dr. Jane Ruth Acheng, this disparity is due to an influx of numbers of positive cases that are detected at the border points into Uganda.
Now at Elegu, we are testing truck drivers returning from South Sudan into the country. When they are going out of Uganda into South Sudan, they are tested, either at Malaba or at any other border point of entry. But when they are returning, they are coming back from South Sudan. So we test them. And when we test them, they are of different nationalities. Some are Kenyans, some are Ethiopians, other Eritreans, Tanzanians, Burundians. Now, if you test a Kenyan at Elegu, it is not easy to transport a positive, either Kenyan, Ethiopian, Eritrean, or Burundian, all the way from Elegu back to their countries of origin. And as you are all aware, we have been having many of the foreign truck drivers test positive at Elegu and Malaba and Mutukula. So the ones that we test positive at Elegu, we keep them in our system, treat them. When they are better, then we transport them to the border points of entry. Similarly, the border of Arua with DRC, when they test positive, the foreigners, we also keep them in.
Dr. Acheng says it is also cost efficient to have such cases treated here without necessarily adding them to our national tally.
Because that would mean the driver, the ambulance driver transporting these people in full PPE, and you know the PPE is hot and it is plastic, will have to be in that PPE until they traverse the country up to the other border point to hand over. It is easier and cheaper right now to bring them over to our facilities and treat them.
Uganda is a transit country, and with over 53 official points of entry and exit for trucks, this, they say, is why we still have foreigners in our statistics.
So on average, the trucks crisscrossing the country on a daily basis during this time of COVID is about 2,500. But before the pandemic, they could go over to 3,500 trucks on a daily basis. That is huge. Right now, we are testing at all the border points of entry for the fact that the countries surrounding Uganda either have more transmission or we don't have information on what is taking place there, so we cannot take chances.
Dr. Acheng says all measures are being put in place to ensure safe trade.
In the interim, until that system is strengthened and it is working, Uganda continues to test all truck drivers before they enter into the country. And we have strengthened the system in such a way that we have laboratories at the heavy border points of entry. So we have a laboratory at Adjumani for Elegu. We have a laboratory in Tororo to cater for Malaba and Busia. And we have a laboratory at Mutukula to cater for the trucks coming in through Tanzania.
She adds that this anomaly will be worked out within about 2 weeks.
So we are in the process of developing guidelines and linking up the national task forces in all these countries so that based on agreement, when these foreign truck drivers test positive at those far off borders, whether it is Elegu or the Arua or at Mirama Hills and all the other 53, then there is a mechanism to transport them safely, whether it is through exchange of drivers on the way and also ensuring that they are formally handed over and they are not left at the border points to be another source of infection.
Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.